Cardon Children's Medical Center, providing comprehensive pediatric care for Arizona's families.
Picky eating and problem feeding. So there's a fine line between the two of them. Picky eating we can kind of deal with, and you can still get by with some good food choices. If we get you early enough, a lot of times we can expand your food choices so that you do have a bigger repertoire of preferred foods and you're healthier for it. I would rather have a parent come in and have them go away with some stuff to do at home and say, they're going to do great, but try these things at home, and if not, we'll see you back in 6 months. Then wait until the child is 2 or 3, and by then they're a full-on picky eater. They've already got their habits and their refusals. They're set in their ways, and then mealtime becomes a battle. Problem feeding is when we really have some issues for things like sensory avoidance of whole food groups, so things that are squishy. We can have things like food refusal altogether. It's hard to put a food in front of your child and have them refuse, and you just don't know why. But a lot of the time it's got sort of an underlying cause.
That's what you think that's going to happen?
Well, he's been a picky eater since birth, and all the doctors would say, he'll grow out of it. He'll grow out of it. Oh, it's okay. You know, he'll start learning to like foods. Once he gets older, he'll start trying foods, but it never ever got to that point. And it took us to get diagnosed with EE for us to get a referral to feeding therapy.
Hi!
Say hi.
We were just talking. The very first time we met was in his evaluation, and he just presented as being logically, that's what you would say is, I'm going to avoid things that are going to hurt my body. So he is just afraid of those foods. Okay, go ahead, smell. And I'll take a smell. I don't know what it smells like. What does it smell like?
It smells like rotten apples.
Rotten? No, it smells good. When you first try some new food, sometimes that's a shock to the system. So like a squishy food can be something that you don't enjoy, but maybe after 15 or 20 times of that squishy food, you'd be like, I can do this. After you've poked it around and you've kind of touched it to your lips a little bit, it's no big deal and you can do it.
It was really frustrating because if we would have helped him when he was 2 or 3, maybe this EE wouldn't be so hard because we'd have other foods to try. We don't, because he wouldn't touch other foods or smell them or anything. If you have any doubt at all that there's something else wrong, go to the pediatrician, just, ask for a referral. It doesn't hurt. It doesn't hurt to come talk to someone and say, okay, this is what my kid does. Is there anything I can do for him?
Good, right? Oh, it is actually good. Evaluation basically consists of what's going on with the child medically, and see if we can figure out, are there food allergies? Is there a motor reason why they're not able to eat? Are they not able to chew? Are they not able to swallow safely? Well, there should never be significant crying, behavioral issues around eating. So if child or baby is always crying in anticipation of eating, if they see you getting out the high chair and they are crying, if they don't want to get in the high chair, kicking, screaming, if you can't keep a child at the table for more than 2 minutes, if they're throwing food, if they have weight loss as opposed to continual weight gain, if they are refusing whole groups of foods.
And it's not the parent's fault. I always felt like, oh, maybe it's my fault. Maybe I didn't introduce enough foods. Maybe I didn't push him farther. Maybe I should have done this. Maybe I should have done that. There wasn't really anything I could do besides, ask for help.